Well, hello, welcome to Perfectly Twisted. I'm Nicole Eggert, and I am joined by my good friend Dave Palais.
Good, good to see you. Always good to see you. I always appreciate when you say that. As I said, we have a mutual friend. He watches the shows, he listens to the shows, and then I always get a recap. And so it's never negative on your part. It's always just a shot. He always goes back to our friendship, our relationship from almost 40 years ago now, of when I first reached out to try and say, hey, this is who I am. I'd like to meet you. And he always goes back to the 80s. And I'm like, but we're way past that. Nicole and I've been doing this now for years. Like we're friends.
This is your same friend who
Yes.
doesn't have a calendar. Is this correct?
Yes, the same one who doesn't have a calendar and wants to claim because he's smart. I say it's because he's lazy. We ripped him, or I ripped him on the show recently, and have not heard the end of it through social media too. Everyone's involved now.
I love it. Well, I was living in a cyber hell the past 2 days. I was invited to be on the board of trustees for Mission Plasticos. I was in the middle of my first meeting, my first trustee meeting, and my phone starts going crazy. I start getting all of these alerts. And by the end of the call, my phone had been completely hijacked.
Oh
They
no.
had gotten into my carrier and switched my phone number and my account over to their device. So they had
Wow.
access to everything. And then they went in and just started changing everything in my emails.
Oh my gosh.
Uh-huh. Yeah. So I spent 2 days, literally 2 entire full days on the phone with my carrier who need to get better at their job. They need to find a better way to make this happen more quickly. It should not take 2 days on a chat where I had to sit glued to my laptop because I couldn't go anywhere. I had to sit here and 12 hours for 2 days. And for them just to change the password associated with my account so that I could then get back into it and we could get my service restored. And what they would do is they would restore the service back to my phone, but the hackers were faster
Yeah.
than the support. And then they were getting in and changing it again and locking me back out. And they were doing all of this while I'm just on hold for quote unquote support. However, the banks, shout out to Wells Fargo and shout out to Apple, who completely had everything on lockdown within a 3-minute phone call. Not even. I was like fraud. They were like, say no more, and just locked everything down. And that was so refreshing because that took a big, weight off
Yeah.
my plate.
I'd be panicking.
Yeah, these people are applying for credit cards, and I'm sitting here on hold waiting to just get back into my carrier. Like, so bad, such bad service. So it was really disappointing and frustrating. And
Sorry that happened to you. We recently had this conversation with a group of friends of mine, and the question was no one knew what the other person was going to say. The question was, what should the punishment be for people who are scammers? Anyone who's trying to separate someone else from their money. Whether it's, for me, I got caught trying to buy a dog online. Thought I was doing a good thing buying a dog, and I didn't get my money back. And then there's, you know what I mean? Anything. Old people who get taken advantage of you, they're trying to go into your phone. What should be the penalty for someone who gets caught scamming?
I mean, I think Jen Shaw was kind of a perfect example. It should be pretty steep. So these people went so far as to call me and pretend to be Wells Fargo. And I was like, you're trying to bang on me right now? Like, I'm too street smart for you. You're not even good at your job. You're not even good at hustling me right now on the phone. I said, you're terrible at this. I said, I'm a single mother, a cancer patient. You're trying to take the little coin I have. Shut up. And I hung up on them. Yeah, we think it's an inside job. We need some information from you right away. I was like, oh, shut up. Just shut up, kid. Like, you are not scamming me. Yeah, they called. Like, so this is a ring. Obviously, these are
Yes.
a bunch of people working together. They should be brought down because that's awful. It's just awful. And, for me, spending all that time doing this, if I was not smart enough to know, I would have given him all my bank information.
Older people do it all the time.
Yes. And
Okay.
somebody maybe in a panic, like I was just not panicking through all of this because I also had to go in for treatment and get my blood work results. And so those came back great. Came back better than normal. So I was like, yeah, I'm untouchable right now. I am untouchable. So you're not going to get me in a my panties in a twist. And so when he called, I could tell he was hustling me on the phone. And, many people wouldn't. Many people would be like, yeah, let's get these scammers. Yeah. And yeah, older people, anybody could fall for that. So it was
You're
gross.
going to think I'm over the top. I'm telling you, I think the penalty should be death. That has to stop. And I'm all for public stoning, whatever it takes, or kick to the groin. I don't care what it is, but it's insane. It is so frustrating. And, as you said, you kind of knew what to do. You were on it quick. The banks, Apple, they took care of you. I have friends of mine whose mothers give money every month to scammers. They just fall for it, and they're in their 80s. They don't understand anything that's happening. Next thing you know, money's missing. It's ridiculous.
Yeah, I mean, I think there should be some sort of punishment where they have to like take care of these people who they've hurt and help them like fix it. Because I was saying to Keegan, I was like, it's wild because if they put this much energy in what they're doing to me, every time I lock them out, they get back in, and it was this cycle, right, for 2 days straight. And they were doing it through the night. Like I thought I had it all fixed the first night. I woke up and they had it. They had access to everything again. And I was like, if they put this kind of energy into something positive, this would, they would be completely different people. But yeah, so I mean, some sort of like helping people get untangle themselves from the mess that they have created for people might be a good like more human than stoning them, maybe. I don't know.
Rather stone.
But yeah, they're dirt. They're the dirt of the earth. So a lot of times on the show, I talk a lot about preventative lifestyle with cancer, right? And it was interesting because the nurse practitioner asked me yesterday again, what are you doing? Why does your blood look so good? And I was like, all those supplements you guys tell me not to take, I'm taking them. All those things you tell me not to do, I'm doing them. And it's just proving over and over that it works. But so I always talk about the preventative and everything. And what I have not really looked into, but is on my radar because of my girls now, is the gene testing, the genetic gene testing. And I was tested, it came back negative, but now I need to go back and really kind of reevaluate what tests were taken, who read the results, blah, 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 because I guess apparently they're not all created equal. And I have guests on today who I am so excited to talk to because these are women making strides and really getting the message out and being brave and not being scared of the conversation. And I watched a film that they made last night called Love, Danielle, and it's about living, knowing that you're carrying the gene and that you are susceptible to getting the disease. And what is the choice? What do you do? What are your options on the table? What choices do you make that are right for you and those consequences? And the movie is fantastic. I always cringe when somebody asks me to watch something about cancer. This is not a cringy project. This is for everybody. This really is for everybody. It touches everybody, men, women, survivors, patients, previvors that they call, that is the term I believe that is being used for when you could be. So without further ado, please let me invite on the talented Devin, Sidell, and Amy Byer, Shainman. I got it. Hi. Thank you so much for being here.
Thank you for that lovely intro.
Yes, thank you.
The movie's fantastic. Let me just start there. The acting is so good. It is funny and sad and real and well-rounded and authentic. So all of the acting, and I think there's so many different characters you guys really brought in, all the different ends of the spectrum, right? Like the aloof dad who just doesn't really get it at all. And, the mom who was a substance abuser and absent and probably was the one that should have gotten the cancer. Like if we look at statistics, right, with the alcohol abuse, but doesn't. And so this is based on your actual real life, Devin. Is that correct?
It is. Although I always have to preface this by saying, like, my poor mother is nothing like the mom in the movie. And she is being such a good sport because the mom in the movie is like really not a great person.
Yeah.
And my
Gosh.
mom is a 2-time cancer survivor, and she is so supportive. She was there for every single one of my sister's chemo sessions. She was there at every single one of my preventative surgeries. So I have to start with that. So yes, it is based on my own life, but we did have to make some choices for dramatic effect.
Oh, God bless her. Yeah, she must be like, how'd I get this short
Poor
straw?
mom. It's amazing. Yeah. But yeah, besides that, I mean, I do have the BRCA1 gene mutation. I was making these decisions of whether or not to undergo preventative surgeries to prevent my risk. And my aunt did die from ovarian cancer. And while I was making these decisions and undergoing these preventative surgeries, my older sister was going through chemo for breast cancer. And it was just this sort of everything happening at the same time, and while it was going on, I thought, this would be a crazy movie. This would be really interesting because you have these 3 sort of generations, or these 2 generations of women who are all coming together, experiencing this together in very different ways.
Yes. Yeah. And, it's interesting because we started hearing about the gene when Angelina Jolie brought it to the table, right? And that's why these conversations are so important. And the more we talk about it, the more ears it lands on, the more, people pay attention and look into it, and we're learning so much more. And Amy, I would love for you to talk more about too the testing that is available and how we get that done and how we process that. But so I got the testing done right away. It was just part of the process, and I didn't pay much attention because who cares? I already had cancer. So I didn't really pay a whole lot of attention to it. And it is something that I'm starting to say, okay, well, now that I'm kind of getting through to the other side, I do have 2 daughters.
Yeah.
And it's like, at what age do we bring this up? Because you don't want to live your life in panic.
Right.
Right. And still, can you talk to us too also about once you do find out if you are positive or negative for one of these many, many gene mutations, the chances and the percentages of still even getting it, because we still are at 1 in 8 women, regardless of family history. So I want to talk on that. And I also want to talk about how the mastectomy looks different when you do a preventative mastectomy. I thought you were very brave to show that. And I was in awe of it because mine looked very, very different. But yours was, it's such a major choice. It's such a major decision that you made, but it is so much more controlled the way that you did it, which I think it's important for women to realize. To do your own mastectomy, you got to keep your nipples, you got to control the size, and if you wanted implants, if you didn't, like, you had so many choices, options, that once it's too late, you don't get these options. You don't get to keep those nipples.
I mean, there's so much. I feel so incredibly lucky. The fact that you can have these genetic tests, and Amy is, we'll talk about all the details. She's amazing, but I just feel so incredibly lucky that the technology has gotten to a point where you are able to preventatively, make these decisions. It's incredible.
And it's not easy. And you did the full hysterectomy. I have that on the books. I'm doing that next. Just yesterday had a conversation with a female nurse practitioner, because you can talk to so many doctors about it, but when you talk to somebody who's also been through it, and she's younger, on the younger side, and it's like it's solidified that I'm making the right decision and we're moving forward. And talk to me about, I think in the movie, do you use and are you using like a hormone patch?
So I started off using a hormone patch. It didn't work very well for me, and I switched to oral hormone replacement therapy. So I'm on an oral estrogen. But I started that. They put the patch on me as I was coming out of my surgery. That was something somebody told me, actually. That was incredible information. Someone who had been through it said to me, tell them to put a patch on right away, like even before you wake up from anesthesia, because then hopefully you will never go through any sort of the menopause, hot flashes, anything like that. And it worked so well for me. It's a great tip.
Yeah, I was not told that, unfortunately.
Yeah, it really gets left out. It's a conversation I've really been focusing on lately, is We are hearing a lot of conversations about menopause and perimenopause, but we're not talking about women who have been through breast cancer, such as myself. I have hormone positive, estrogen positive to be specific. So I cannot take anything oral, but there are other things that can be done. And really, a lot of us just get left. They're just like, oh, well, you're lucky you're alive, a little hot flash, whatever, a little night sweat. But you're here to have it, and you're like, well, wait a minute, quality of life, and it's through stages, right? At first you're like, okay, and your character went through this. And obviously you must have gone through this journey too. It's like, okay, the boobs, get them out of here. We don't need them. If they're trying to kill us, we don't need them. And then they're gone. And then you're like, time passes. And then you're like, well, wait a minute. I like boobs. I like boobs. I liked having boobs. Do I want boobs? It changes.
It changes. Absolutely. And it still changes to this day. I mean, and decisions of having biological children or not. I mean, there are days when I wake up and I think, oh my gosh, I made the wrong decision. Why didn't I should have had biological kids, and I'm never going to look at a child that has been created from me and my husband. I'm never going to see, those moments where you're holding the baby on your chest and, skin to skin, all these moments that you see friends having. And so there are days when I think maybe I made the wrong decision. And then there are days that I wake up thinking, that's crazy. I don't have to worry about getting ovarian cancer anymore. I can live, but it's not, you don't just make the decision, then it's gone.
Right. Well, let me ask you, what kind of screenings do you have to do, if any, going forward? Now that you've had, Devin has had double mastectomy and full hysterectomy for preventative care.
We say oophorectomy, which is the removal of the ovaries as well.
So, right. So everything. So going forward, because it's not like it completely eliminates your chances of getting cancer, which is the crazy part, right?
So crazy. So frustrating. Yeah.
So what kind of screenings do you have to do going forward, if any?
Amy is the key for this.
Yeah, and those are questions that come up so often in like the support groups and everything. What do we do now? What now? So I had the same exact surgeries Devin did. In terms of, I got everything out: hysterectomy, oophorectomy, double mastectomy preventatively. And if you have implants, you're supposed to go back to your plastic surgeon once a year. Whether you get an MRI from that appointment, you have to basically, that's up to the both of you, checking your integrity of your implants, making, how long have you had them in? Usually the rule of thumb with that is, if they're not causing a problem, just keep them in, kind of. But, everything is still very highly patient specific. In terms of, we are still at risk for peritoneal cancer. It's a very small risk. That's the lining of the abdomen. It's like, 1%, maybe 2% risk, but it's still there. And I know women who have had these preventative surgeries who have gone on to develop peritoneal cancer, which is, there's nothing we can really do to screen. When I go for my appointments, I'm managed by a high-risk oncologist. They do take my blood every time I go. I go every 6 months. They take my blood, and they still are checking CA-125, although that's the ovarian cancer tumor marker test. It's debatable, whether it's useful. People say, I like to look at it like a tool. Sure. If it's elevated, maybe that will cause them to say, hey, let's look at something else, more definitively. Let's run you through some more tests. I also get a CA-19-9 for the pancreatic cancer marker screening, because I have a family history of pancreatic cancer. And so that is something that's also recommended for me. I get bone density scans. That's something that's important, because once you've had your ovaries removed and you don't have that protection, of those hormones, you are more susceptible to those, osteoporosis and bone fracture. So that's another thing that I get done. gosh, there's people think it's over, but it's not. Devin and I are professional patients, and we're constantly texting each other going, hey, I was just at the doctor, what did you have done?
I just texted Amy this morning about that.
Yeah, like
Never ending.
cardiologist, because you can have heart issues after these surgeries people don't talk about. I still get a clinical breast exam when I go, because yes, hopefully your breast surgeon was amazing and preventatively got out all of the breast tissue. But I also know women who maybe that surgeon wasn't quite as aggressive as they needed to be. And they had some residual breast tissue and they developed breast cancer still. So, you do need, I always say it's really great if you can find an oncologist who will manage you as a high-risk patient. Please go see them. I also get colonoscopies, the EUS, endoscopic ultrasounds. So I am a professional patient still, and so is Devin.
So am I. I
Yes,
can join your club
too, Nicole. I'm sure. Yeah.
Yeah. It is. And let me also, for the audience listening, Devin is an actress and a writer and a producer and obviously an advocate. And Amy is obviously a patient and advocate. And they're really working hard to spread, news and positive information and reliable information. So tell me what you think, like, what is a good age if you're thinking like, should I get the test, should I get the gene test? Where do you go so that you're not wasting your time and money if you have to pay out of pocket, and B, like, you want the results read back properly to you and you want them done thoroughly, and what age should you be doing this, do you think?
Okay, I will take that one on. So that's a lot of I will try to answer as clearly as I can. So the first question, where do you get the gene test? Well, let's rewind a little bit. There are thousands of gene mutations. And so when we say the gene test, and you said you had the gene test, I immediately want to say, well, what were you actually tested for? What panel was it? What genes were on that panel? What was the lab? Who ordered that test? Who gave you that test? Who interpreted those results? And do you have a copy of that test in front of you? Because genetic test results mean nothing if they don't have meaning attached to them. Okay, so that's really important, that you have the correct person assessing you, ordering the correct test, if any, the testing panels, and almost most importantly, interpreting those test results and providing meaning for you in your life going forward. And so really the most qualified provider to do that is a certified genetic counselor. And you can find one. Many cancer centers or places have certified genetic counselors working in them. For whatever reason, if they don't, you can find one by going to nsgc.org, which is the National Society of Genetic Counselors, and you can talk to one by telephone or in person. There are also other avenues. So now all genetic testing isn't created equal. There are some direct-to-consumer genetic testing options, but you have to be very careful with that. And because you want to make sure you have one that, number one, is reputable, medical grade, and also has genetic counseling with it. And there are really only quite a few. And instead of naming them here, we can, you can go to my website and resources. That's down another rabbit hole. But I would say if you have an inkling there's cancer in your family, the best first step is reaching out to a person you can have a conversation with, because the key thing with genetic counselors too, Nicole, is that doesn't mean that you have to undergo genetic testing. The most important thing is to have a conversation, find out what it all means. Are you a candidate? Yes. Does your insurance cover it? Because money is a big question that people have. If it doesn't, what will it cost out of pocket? Other things people don't know about is that it's really important before any genetic testing to have any life insurance in place. Because while you cannot be discriminated against with health insurance, that does not apply to life insurance.
Wow.
Yeah, and people don't know that. So the conversation is really important to educate yourself about what it might mean for you and what it might mean for your family. Because let's say you do test positive, okay, for something. Let's say, I'll use myself an example. I'm positive for BRCA1 gene mutation. Okay, well, what does that mean for me and for my family, for my children? You want to make sure that someone is counseling you appropriately and you know what that means for you and your family moving forward. And in terms of what age, that segues really well into that next part is, so for BRCA1 and 2, medical management starts at age 25, okay? Or 10 years prior to the earliest cancer in your family. And again, I like using myself as an example because it's easy. So the youngest cancer in my family, my grandmother died when she was 33, which is very young. She probably started getting sick at 31, metastatic breast cancer. She most likely had ovarian cancer as well. So now I didn't find out even about all of this, which is, part of my story, until I was 40, which I feel so lucky that I escaped, evaded a cancer diagnosis up until that point. So I was really scared, and I pretty much got surgeries right away. I was 40. So this next generation in my family, they're going to be finding out a lot younger because now they have that knowledge. So if my grandmother started getting sick at 31, 32, if you count back 10 years, that's like age 21, 22. That's really young. But there's the other component of the emotional component and who is your child. So you have to take all of those things in consideration. And there's some really good articles out there on this that I refer to people all the time. But it isn't one size fits all. You most likely, if you're female, carry a BRCA1, BRCA2 mutation. If you have not undergone testing by the time you're 25, you at least have to start your screening. So genetic testing is one thing, but at least undergo your screening starting at age 25. Now, you're at age 18, you're an adult. You can find out if you want to. I chose in my own family only to discuss it in certain things and when my children were a little bit older, because I knew who my kids were and what they emotionally could handle. So I didn't think at age 21 my daughter was ready for that information, that she needed to be pushed. She knew about what I did and the gene, but to be pushed into the whole counseling appointment, because I wanted her to finish college. I didn't think she was emotionally ready. But it's a really nuanced situation if you have early cancer in your family. If you do have early cancer in your family, it would make sense to undergo genetic testing and genetic counseling early. But basically, medical management starts at age 25, and that is sort of the gold standard.
It's wild. That's crazy because I have a daughter that's 27. And she's not doing any testing, and obviously it's not up to me, right? If I could have it my way. So there's that aspect too. It's like, do your kids even want to hear about it, right? Do they even want to listen to you? They're on their own journey, and it has to be their own decision, obviously. And it's, and you don't want to push it on them because you don't want to make them fearful, unnecessarily. And you also don't want to alienate them from conversations, right?
You're right. You have to give them their autonomy, though. And that's why the whole suggestion of, hey, you know what? Go have an appointment with a genetic counselor and just talk to her. It's a conversation, and just leave it at that. And that way you can be mom and the genetic counselor can be the expert, and really say, hey, this is what this could mean for you. This is the test we're going to do or not do, or, and talk to, they can be the provider and you can be mom. That's how I've approached it.
That's really good advice. That's really, really good advice. And yeah, I want to now go back and revisit the testing I had done because, like you said, so it was from my oncology surgeon, which I am no longer working with that office anymore because I found them to not be I'm going to be nice, like the most competent. And they didn't have my trust. They lost my trust. And that's major for me. And I'm not going to tolerate a lot of things. We as patients, we get so tired, right? Like we get so tired of all these appointments and especially when you're sick and you're not feeling good to then go search for another doctor and start the whole
to advocate for yourself. And
yeah, it's a lot. But I am that person that I'm just going to keep doing it. And so, yeah, I left my oncology surgeon, but they're the ones that did the testing. And all they told me was like, it came back negative. So now, yeah, I'm going to march into that office and ask for the files and the results and, have somebody else look at it and say, what did they do? Because going into it, I didn't know. I was so new to the whole entire world, as so many of us are. Like you're walking into this and learning as you go along, and you just think, oh, it's just like they do a blood panel, and either you're positive or you're negative, and it's just not that simple.
It's not that, because there are over 50 hereditary cancer syndromes and thousands of gene mutations, and they all have different meanings. It's not just BRCA1 and BRCA2.
No, and it's not just for women, it's for men too.
Yeah.
And I think a lot of men don't think about it. And they and for breast cancer, they really don't think about it much.
No.
And they don't think about it if they have daughters, right?
That's why we put it in the movie. That was sort of Amy. That was one of Amy's babies in the film. She was like, we have to have a scene about a man getting a mammogram or a man who has the mutation. And it was based on Amy's friend, who is a man and who has a mutation and would go to appointments and would be called Mrs. Whoever, and would be wearing his pink robe, and just how difficult that must be for some men, and how we need to get the information across that men can carry this too and pass it down.
Yeah, and can they have a place that's a little bit more masculine to go get their testing done?
Where they're not being asked about their last periods. Yeah.
I mean,
yeah, exactly.
A lot of men embrace the pink, and we love that, and that's great. But some men, they might not, and they might want to be around other men going through this, and not a room full of women, and not being asked about pregnancies in their last period. Like,
yeah,
it's true. And so, what do you think about men that their age? Is it sort of the same standard for women?
No, yeah. I mean, that's a great question, because the ramifications for men are different. So, and that brings up, I inherited my gene mutation from my dad, who was an only child, and his mom had died young. So we didn't have that history, and he didn't have any cancers up until he was 80. So, so the ramifications are different. So really in their 30s, by the time they're 30, if there is a gene mutation in their family, a known gene mutation, BRCA1 or 2, they should start, talking to a healthcare provider and possibly, getting mammograms. And by 40, the prostate cancer PSA exams, it's different for men. It's a little bit older. The risks are still there, but the percentages are much lower. We're talking with women, if you have BRCA1 or 2, it can be a 60 to 80% range. There's a range. It's important to give a range. Breast cancer risk, and for men, the breast cancer risk can be 3 to 5%, maybe a little bit higher. So it's still important. Men meet with a genetic counselor, but the ramifications are a little bit different. But yes, I know many BRCA men.
Yeah. So what do you say to someone who is like, this is their thought process? They're like, well, I could go get tested. I don't know a lot about my family history. So my chances are whatever. And you're saying 60 to 80%. Well, I hear 1 in every 8 women are getting it anyways. So my chances are 1 in 8. So that's a high percent anyway. So what would like a lot of people like to live in the unknown, right? They like to live in the gray area. What they don't know doesn't kill them, and literally. And they hum and haw about it because they're now saying, well, I could get it anyways. We all have this really high risk. So explain a little bit to people who don't really understand the benefits of knowing early and doing the preventative.
Yeah, well, just as what you just said, you could say to that person, I like to say, well, I could also get hit by a bus, but if I saw it coming, I would probably jump to the side, you know, or jump away from it. You know, it is a tough one because people are who they are, and you're talking about anything, you know, people are going to have their opinions. We know this in this world today. People have their opinions about things. So what I like to do is really just, you know, say, hey, look, you know, obviously I want you to do what's right for you. I would really encourage you to just go have a conversation with somebody, the most qualified person who could counsel you, because, you know, they understand what all of this means, and they could actually tell you more effectively, you know, than I can. And even from what you know of what it all might mean for you, and give you the actual percentages. And, you know, the other thing I would probably say too is I would share a little bit of my own story and why my own choices for prevention, because oftentimes when you make it more personal, I think people, you know, they respond better instead of more abstract. You know, you're giving them a tangible experience that they can relate to. And, you know, one of the reasons I made my decision for the mastectomy, double mastectomy, is I had learned that not only was I at high risk for breast cancer, and I had dense breasts because of my BRCA1 mutation, I was at high risk, but BRCA1 female carriers have if you do get diagnosed with breast cancer, it's a 75% chance that you are diagnosed with triple negative breast cancer.
That's major.
Which is major. And you know, my close friend, I had witnessed her BRCA1. We had the same mutation, triple negative. She ended up passing away. I saw how aggressive it was. I saw the chemo. I saw the regimens. And you know, we had the same breast surgeon, and he just basically said to me, you have an opportunity to avoid all of that.
That's a great
avoid death. And avoid death.
That's a great takeaway, because we don't really realize that. And that's something I've learned here today, is that if you do have the gene, if you get it, it could be this really horribly aggressive cancer that's not easy to deal with. That right there is enough to really seriously consider preventative surgery. It's a big deal. You don't want to go through it. I mean, nobody wants to go through chemo. Nobody wants to go through the full mastectomy once your breasts have cancer. It's, you know, it's amputation opposed to, you know, clinical and medical, and them going in and neatly removing everything and, you know, putting things back where they should be. And yeah, it's a lot. So that's a great, that's a great takeaway. That's scary.
It is scary.
My sister had triple negative as well. She's doing well now, which is amazing. But yeah, I'm glad you guys brought that up, because yeah, Nicole, like, you've been through chemo, you've been through all of this stuff. My sister has been through it. I watched my mom go through it. I think when you watch a family member undergo it as well, that can change your mind about the genetic testing and the preventative surgeries, because it's just, yeah, exactly what you said. Nobody should have to go through that. It's horrible. And if there's any way that you can help other people to avoid having to undergo all of that horrible stuff, then that you want to do that. You want to help people, and you want to make that decision for yourself. Again, not everyone will make that decision, and we can't change their minds, but it's just, nobody should have to go through what you went through, what my sister went through, what all of these people are going through.
Yeah, it's true. Like when my nurse practitioner said to me yesterday, she wanted to know my reasoning for having full hysterectomy and ovary removal and all of that, because I'm on Zoladex treatment, which suppresses the ovaries, stops it from making any estrogen. And those are up. I guess I have the choice to stop getting those shots in July. It'll be a year.
Oh, wow.
So I was faced with this. Well, if you're almost through, us completely drying out your ovaries, what is your reasoning? And so we had this conversation, and she had one done, but she was much younger. So for me, I've had my children. It's kind of a no-brainer for me because I'm already having thickening of the uterine wall from all the medications I'm on, which is another thing that people don't realize that I think is important. Once you do have cancer and you're on all the preventative cancers, they cause other cancers. They cause heart disease, as well as the treatments, the chemotherapy, the radiation, and then you're on all these medications, which then a lot of women die of heart disease that are cancer survivors, and that sort of is not talked about. So there are all of these risk factors. So I was saying to her, well, I think that down there, it's just problem children. Everything down there is problematic at this point and can only bring me misery and problems. I can't get anything positive out of my reproductive system at this point. And she was really happy to hear that. And she said a lot of women are not that open to it. They do look at it from a more emotional standpoint. And I'm really looking at it from like trying to make smart medical decisions.
Mm-hmm.
And yeah, sometimes it takes knowing somebody or going through chemo, and you just don't really want it to get there. Like you think, but you don't. You don't want to take the chance. You don't want to take your chances, people. You just don't. It's hard. It's hard and it's ugly. The movie is Love, Danielle. Where can people watch it?
It's available on streaming, Amazon Prime, Apple TV, and I think also some other sites like Fandango. So there are lots of places you can find it. It's also on Hoopla, right, Amy? Through the library. So yeah, lots of places to stream it.
Well, I highly recommend watching it. It's fun. And I know that's so weird to say, but it is. It's fun to watch the relationships too, like the family dynamic. And it made me think, because I went through it single and alone, and I'm a single mom, and I don't have family. And I look at it like it's so different. And it's like all decisions in life. Half of me is like, God, I'm really glad I didn't have to deal with all these people. And all these personalities, right? And their opinions. I got to do things my way.
Right.
And then the other hand of that is like the comic relief of having and the support of having family around you and all of that. Everything is always 50-50, right?
Mm-hmm.
But also Amy, tell us where we can go and find a genetic counselor. Again, give us that website again.
So you can go to nsgc.org or if it's easier to remember, find a geneticcounselor.com or find a geneticcounselor.org. I think they all work. And you can click on telehealth or in person. And sometimes, telehealth, it's a safety net for people because, they don't have to go anywhere. So that might be something that, appeals to someone. But you can see in person or telehealth, and you type in your state, your city, zip code, and the specialty drop down would be cancer.
Amazing. And give us your socials, both of you, so people can follow you.
I'm BRCA responder pretty much everywhere.
And I'm Devin.Sidell.
Thank you, ladies, so much. Thank you for sharing and having the conversation and making it authentic and light and real and just not so scary, because the more information you have, the less there is to be fearful of, and the more you can handle things with the more information you have behind you. So we need to keep having these conversations, and this is where it starts. So thank you so, so much.
Thank you so much, Nicole, for having us.
Thank you so much for having us.
Yeah, really, I loved it. I loved it. And thank you for the movie. We need it. We need it.
Let me know if you need more info, Nicole.
Okay, great. All right. Thank you so much.
Okay.
Bye-bye.
Very good. Very good. That was always informative, and I said I love the shows where obviously you're able to help people, and I think these are important topics. And I thought again, outstanding guests, fantastic.
Well, it's really about giving people the tools to help themselves, and make their own informative decisions, because it can be so overwhelming, and like, who wants to deal with it? There's so many other things to deal with in the day. Who wants to deal with cancer? But to, kind of cut through all the chaos and the noise, and, kind of be given a clear path of where to go to get clear, quick, precise answers. Not that anything is clear, quick, and precise, but you know what I mean? Like,
Yeah.
definitely a more direct path to getting some answers, and, knowing your options. And it's just, it's rampant. We know that it is. It's attacking all of us, from the foods we eat, the products we use, the alcohol we consume. And Dave, that reminds me of, you quit drinking. Have you finally given up your habit?
Yeah, I've quit drinking. It's that's so funny. Yeah, I have to go in. I told you, like, for the people who aren't aware, a couple shows ago, I got the call saying the inflamed liver, and the doctor said quit drinking, but yet I'm not drinking. So, but they keep telling me stop drinking. I don't know what to do. I don't even know what to say.
Yeah. You got to look at your diet.
And then I look at, I know that's what everyone says. But when I sit there and I look at friends of mine that just sit there and drink nonstop, and they don't have the flame liver, and yet here I am, a person who doesn't drink, and yet I'm the guy getting the call, hey, we need to come do a scan. I don't know. You just never know.
Well, here's the other thing: people that are drinking like fish, they're increasing their cancer rate. They are realizing it's an astronomical percent. Okay, so let's not pretend that doesn't exist. And are they having the proper testing? Do they even know if their liver is fatty, because they're not going and getting that test? A lot of people live in denial, Dave. A lot of people.
You're absolutely right. You're absolutely right.
So so go check out the movie. Love Danielle. The cast is amazing. Jamie King plays her younger sister in it, and she is so good. She's so good in it and believable, going through chemo. Leslie Ann Warren plays the mother. She's fantastic. The entire cast is the men are amazing too. It's really well rounded. It's enjoyable. It's informative. It's a quick watch. It's not one of these long drug out, movies. It really is a good time and a fun little ride that, just kind of is eye-opening.
Yep.
So go check it out. And thanks for joining us. And we will see you next week.